Let's discuss about the ischium. It is faced at the posterior inferior part and it consists of two parts, body and the rami. Body. Now let's take about the body. Body, it consists of following parts. This is anterior border, this is posterior border, and this is the lateral border. And there is a presence of a tuberosity which is known as the ischial tuberosity. About the attachment of the ischial tuberosity and its division. Ischial tuberosity is divided into two parts by a horizontal ridge into the upper part and the lower part, and upper part is further divided into two parts by the oblique ridge into superior lateral part and the inferior medial part. And the attachment of the superior lateral part is semimembranosus muscle, and the attachment of the posterior medial part is the long head of the bicep femoris and the semitendinosus muscle. And the lower part is further divided into two parts by a straight vertical line into the lateral part and medial part. Lateral part give attachments to the hamstring part of the adductor magnus muscle, and the medial part here attaches the fibro-areolar fatty tissue which supports the weight of the body while in sitting position. And it consists of three surfaces which is known as femoral surface, this is known as posterior or dorsal surface, and this is known as the pelvis surface. And the attachment of the femoral surface is the obturator externus muscle arises from the lower femoral surface adjoining the obturator foramen, and quadratus femoris muscle takes its origin along the upper part of the lateral border of the ischial tuberosity. And the pelvic surface give attachments to the obturator internus muscle. And the posterior surface we have discussed about, there is presence of the ischial tuberosity. And now let's discuss about the ischial spine here and its attachment. Here attaches the tip of the ischial spine, gives attachment to the suprasacrospinous ligament, and the anteriorly there is attachment to the levator ani muscle, and posterior to that there gives attachments to the coccygeus muscle. Now let's discuss about the relation of the posterior relation of the ischial spine. Posterior surface on the back there are presence of the pudendal nerve, internal pudendal vessels, and nerve to the obturator externus. And let's talk about the lesser sciatic nerves and its attachment. This is lesser sciatic nerves, and the upper part gives attachment to the gemellus superior muscle, and the lower part gives attachment to the gemellus inferior muscle. Now let's talk about the ischial rami. Ischial rami, it unites with the inferior rami of the pubis to form the ischiopubic rami. It has two borders, and this is upper border and this is the lower border, and two surface, anterior surface and posterior surface. Anterior surface, and let's discuss about its attachment from medial to lateral. Medially it attaches the gracilis muscle near the lower border, adductor brevis muscle, adductor magnus, and obturator externus. Consists of two borders and two surfaces. This is upper border and this is lower border. This is anterior surface and this is posterior surface. Upper border gives attachment to the obturator foramen membrane, and the lower border gives attachments to the fascia lata and membranous layer of the superficial perineal fascia. And the anterior surface give attachments to the following muscle from medially to the laterally: gracilis near the lower border, adductor brevis, adductor magnus, and obturator externus muscle. And the posterior surface is divided into two parts by a ridge, indistinct ridge, and into the pelvic area and the perineal area. And let's discuss about the perineal area attachment. Here attaches the sphincter urethrae, ischiocavernosus, and transversus superficial perineal muscle. And the pelvis area gives attachment to the obturator internus muscle. About the pubic bone, it is present on the anterior inferior part, and its parts are the body and two rami, that is superior pubis rami and inferior pubis rami. Body. Now let's talk about the body. Body is quadrangular in outline and it consists of a superior border which is known as the pubic crest, and lateral to it there is presence of a pubic tubercle, and this is pelvic surface, anterior surface and symphyseal surface. Anterior surface gives origin to the following muscles, and anterior surface is divided into smooth part and upper drop part. Upper drop part gives attachment to the anterior pubic ligament. And let's talk about the muscles from medial to the lateral. There is gives attachment to the adductor longus muscle at the angle between the pubic crest and symphysis pubis, and there is gives attachment to the gracilis muscle near the medial margin of the inferior rami, and adductor brevis muscle lateral to it, and there is obturator external muscle lateral to the adductor brevis muscle. Now this is let's talk about the attachment of the pelvic surface. At the center there attaches the levator ani muscle, and lateral to that there attaches the obturator internus, and here medially here attaches the ligament named puboprostatic ligament, and this symphyseal surface is attached with the symphyseal surface of the opposite bone and from the pubis symphysis, and the articular surface is surrounded by the hyaline cartilage. Let's talk about the attachment of the pubic crest and pubic tubercle. Pubic crest, laterally it gives attachment to the rectus abdominis muscle lateral head, and below it here attaches the pyramidalis muscle, and the attachment of the pubic tubercle are medial end of the inguinal ligament, reflected part of the inguinal ligament, apex of lacunar ligament, lateral cross of superficial inguinal ring, and ascending loop of cremaster muscle in case of male, and relation of the pubic tubercle is spermatic cord in case of male, and round ligament of uterus in case of female. Now let's talk about the rami of the pubis, that is superior pubic rami. It has three borders: this pectineal line, obturator crest and inferior border, and three surface: pectineal surface, obturator surface, and this is the pelvic surface. And let's talk about the attachment of the pectineal line, and according to the attachment it is divided into two parts: lateral part and the medial part. And the medial part gives attachments to the following parts from before backward. Here gives attachment to the lacunar ligament, reflected part of the inguinal ligament, conjoint tendon and fascia transversalis, and lateral part gives attachment to the following from behind forward. They are pectineal ligament of Cooper, pectineus muscle arises from the pectineal line, and fascia covering the pectineus muscle, and Schwartz manner if present attaches to the iliopubic eminence. And attachment of the obturator crest, here the attaches the pubofemoral ligament, and attachment of the inferior border is the obturator membrane. And let's talk about the attachment of the surfaces. Attachment of the this pectineal surface attaches the pectineus muscle, and the pelvic surface gives attachment to the lateral umbilical ligament. About the obturator surface, here is presence of the obturator notch, and it is converted into the obturator foramen with the help of a obturator muscles and the obturator membrane, and the structure passing through it are the obturator nerve, obturator artery and obturator vein from above downwards. Now let's talk about the inferior pubic rami. Inferior pubic rami consists of two borders and two surfaces. This is medial border and this is lateral border, and two surfaces: anterior external surfaces and posterior internal surfaces. And the attachment of the anterior external surfaces from the medial to the lateral are the gracilis muscle, adductor brevis muscle and obturator externus muscle. And if an adductor magnus muscle may be present in between the adductor brevis muscle and obturator externus muscle. And the posterior surface is divided into three areas by a two indistinct ridge into the medial area, intermediate area and the lateral area. Medial area, the relation gives the crura of the penis, and in case of male it is thickened for the attachment of the crura of the penis. Intermediate area is related to the dorsal knob of the penis or clitoris and internal pudendal vessels, and the lateral area give origin to the obturator internus muscle. And this medial border is strongly everted in case of male and in contact with the crura of the penis, and the lateral border it forms the medial boundary of the obturator foramens and give attachment to the obturator foramen. And this obturator foramen in case of male is larger and oval in shape, and in case of female is smaller and triangular in shape. And this inferior pubic rami and the rami of the ischium unite to form the ischiopubic rami, and it is thickened in case of male and it is